Thank you, Mr. Chairman. Last week, our president discovered that health care was complicated with a meeting with the governors. In fact, he said famously, "Who knew?" Well, every member of this committee knew that health care is complicated. We've got some great little buttons that say "we knew," and I think our Republicans knew. What we've had in the backdrop with this administration is the claim by the president that we're going to have health insurance for everybody. Quote, it's going to be, people can expect to have great health care. It will be in a much simplified form, less expensive, much better. He's gone on the airways repeatedly, and the Vice President, with this pledge to the American people. Now, we're in somewhat of an awkward position here. Despite the claims from my good friend, the Chairman, we haven't scratched the surface of dealing with this in the ongoing, thoughtful fashion we did when we had the Affordable Care Act, with hundreds of hours of work, dozens of witnesses, committee hearings, a CBO score. We're forced to rely on articles that are being published frantically in the last 48 hours. We have organizations that are coming forward, the American Medical Association, the Hospital Association, AARP, pointing out the flaws in this proposal. Mr. Chairman, I have a very simple amendment. It would state that nothing in this bill would take place unless the Congressional Budget Office certifies that everybody gets health insurance as a result of this bill, that it keeps President Trump's promise that it will be at least as good. I think, Mr. Chairman, that this is kind of the least we should do. We're rushing into this blindly. We don't have a score. We've never had at the witness table, I feel sorry for Mr. Barthold because he handles this well, but he's sort of on the receiving end. The questions that have been asked should have been asked to experts in healthcare, in economics, insurance companies, the medical profession, hospitals, people who care for the disabled, people who manage programs on the state level. There ought to be a full and complete hearing of the implications. The fact that we're going to have 50 to 64-year-olds with a 60% increase in their premium rates, that ought to be a concern to everybody on this committee. It ought to be available for the American public to decide whether or not the increase in financial burden on citizens who are approaching Medicare but not quite there yet, that should have been part of this debate. Well, it should have been part of the effort here, listening to the experts about the impact of taking $170 billion out of the trust fund for Medicare. The president has famously promised that it wouldn't be touched. And this proposal ends the guarantee that we rely on with Medicaid and its expansion. This bill, if enacted, would begin the retreat of Medicaid, capping, lowering, shifting burden to the states, putting the people who deal with the elderly and disabled in chaos. My state will lose almost $1 billion in 2019 as we're struggling with two-year budgets. So, Mr. Chairman, because we haven't followed regular order, because we don't have a CBO score, because we haven't heard from experts who could give dimension to these challenges, I think the least we could do would be approve my amendment to make sure it doesn't go into effect unless we can certify the president's claims about a health care program that's going to be great, going to be less expensive, going to cover more people, unless we can prove it. And I'd respectfully suggest that we all ought to approve this amendment to give the American people the Trump guarantee.